So today we're going to be talking about the influenza virus vaccine. In this presentation, we will be talking about what the influenza virus is, who is most at risk, modes of transmission, and different numbers associated with the virus. We will see why getting vaccinated for the flu is a great option for everyone. We will begin by talking about groups most at risk for flu complications and the modes of transmission for this virus. The flu is a virus that can be caught by anyone. Although adults 65 years and older, pregnant women, young children, cancer patients, and anyone who is immunocompromised are at a higher risk of dealing with complications. In order to protect these people, a flu vaccine is highly recommended by medical professionals. The modes of transmission include direct contact. This would be literally touching someone that has the flu. Another mode of transmission is droplets. This mode of transmission is the one most people believe gave them the flu. If an infected person coughs, sneezes, or even talks to someone within 6 feet, they can spit out droplets containing the virus. The last mode of transmission is aerosol, which means the virus can live in the air for long enough to infect someone. This last mode of transmission is still being tested, but many scientists believe it to be true. Next, we will talk about the incidence, prevalence, and mortality of the flu. The incidence for the 2010-2011 flu season was about 21 million new cases out of the 311 million people in the United States. The current incidence increased by about 17 million, meaning 38 million new cases out of the 328 million people in the U.S. The prevalence for the 2010 to the 2011 flu season was about 7%, and the current is 12%. And lastly, the mortality rate for the 2010 to 2011 flu season was about 0.18%, and the current one is about 0.06%. The mortality rate decreased by about 0.12%. And now to the signs and symptoms. Here I will talk about the most common signs and symptoms an infected person might experience. Muscle aches are usually one of the earliest signs that someone has the flu. These muscle aches are then followed by fatigue, a runny nose, dry cough, and a high fever. Symptoms for the flu come rapidly after being infected. These signs and symptoms appear after only a day of being infected. Here I have a picture of how the virus enters the cell and replicates. The virus has hemagglutinin, which is a surface protein that binds to the surface of the cell. This triggers the cell to engulf the virus. Once inside the cell, the RNA begins to replicate. This replication peaks at about 48 hours after inoculation into the nasopharynx and begins to die down afterwards. This is the reason why a person feels the worst on their second or third day of being sick. After that, a person begins to slowly feel better. The flu is actually easy to prevent. The flu vaccine is the biggest preventative measure used by medical professionals, but just like any other virus, washing your hands regularly, not touching your mouth or nose with unwashed hands, and disinfecting surfaces that are touched daily can decrease the chances of being infected. These are all the same preventative measures used to prevent the COVID-19, which is pandemic going on right now. The treatment for the flu is usually only rest and drinking lots of fluids. The body can fight the virus off, but it is important to stay hydrated during this time. Some people like to take medicine to treat their symptoms, such as Tylenol, to treat a fever and headaches and muscle aches. Although this might help subside the symptoms, it will not make the flu leave any faster. But it is still a good way to deal with the pain of the flu. If someone at high risk for complications gets the flu, this is usually when antiviral treatment is given. Antiviral medicines such as Tamiflu, Relenza, Rapivab, and Xofluza, these all have mild side effects like nausea or maybe even diarrhea. Although that sounds unpleasant, antiviral treatment is absolutely necessary for certain individuals. In order for doctors to know if antiviral treatment is needed, they have to test for the flu and diagnose someone with it. There are quite a few different ways someone can be tested for the flu. Although all these tests are different, all of them require a person to get tested in between 3 to 4 days of being infected. This is when the test will be the most accurate and will prevent a false negative from happening. The different types of tests are viral culture, which is very accurate with a percentage of over 90% accuracy. It takes about 3 to 10 days to get the results back. Another test is rapid influenza diagnostic test, which isn't as accurate but gets results in less than 15 minutes. This test is usually followed by another, such as the reverse transcription polymerase chain reaction, which has a very high accuracy. It takes about 1 to 8 hours to receive results for this one. Another quick test that takes about 15 minutes to get a result is the rapid molecular assays. Unlike the rapid influenza diagnostic test, this one is actually very accurate. The last test is the immunofluorescence test, which uses a fluorescent microscope to detect antigen only on the flu virus. This test is very accurate and takes about 1 to 4 hours to get results. Now that we talked about how the flu is detected, let's talk about how the vaccine is made. There are 3 different ways the vaccine has been made for the past few years. The first is the egg-based fluid vaccine. This is the most common way vaccines are made and can create both the flu shot, which is the inactivated virus in the vaccine, or the nasal spray vaccine, which is a live weakened virus. The second is the cell-based flu vaccine, which is the same process as the egg-based vaccine. The only difference is that the virus isn't grown in eggs. Instead, they are grown in animal cells. The last way to make the flu vaccine is recombinant flu vaccines. This method doesn't require eggs or cells in order to replicate the virus. Everything is done synthetically. Scientists create a recombinant virus that grows the antigen hemagglutinin, the same antigen I talked about earlier, that triggers an immune response from the immune system. This antigen is put into the body via a flu shot, and the body will be triggered to create antibodies against it. And now to the cost, risks, and benefits. The vaccine is actually very cheap and could actually be given for free. A lot of places, such as CVS, provide free flu shots every year. Although, if a free flu shot isn't found, the price can range from being free to $50, all depending on medical insurances and type of vaccines being provided. Some risks associated with the vaccine are soreness and swelling where the shot was given, fever, muscle aches, or headaches. Another risk is an allergic reaction. Although this one can be serious, every medicine has this risk, therefore it shouldn't scare people off. I do believe the benefits for getting the vaccine outweigh the risks. The benefits include reducing the chances of hospitalization, preventing a person from getting the flu, and protecting the people around them, and reducing the severity of the flu in people who get vaccinated but still get sick. So why do people oppose the flu vaccine? The flu vaccine has many benefits, but some people are still afraid to get it. 2 of the most common misconceptions I've heard about the flu shot are thinking being healthy means you don't need it, or that the flu shot gives you the flu. Although healthy people can usually fight off the virus pretty easily, the flu can still cause other serious illnesses that even a healthy person might have a hard time fighting off. This is why it would be better to prevent the flu altogether by getting vaccinated. Other people think getting the flu shot will give you the flu, but this is wrong. An inactivated or weakened virus cannot get you sick from the flu. Some discomforts might be experienced, but nothing that would be on the level of severity as the flu virus itself. If someone does get sick from the flu, that would mean they were already exposed to it before the flu shot, or they got sick in the 2 weeks that it takes for the flu shot to become effective. So do the benefits outweigh the risks? Like I said, I do believe that the benefits outweigh the risk. You're not only protecting yourself, but also the people around you. In my household, everyone takes the flu shot every year to protect ourselves and my brother who has leukemia. I think everyone who can get the vaccine should get it, although I don't think it should be mandatory. The flu shot is not 100% effective yet, but hopefully it will be and people will stop being afraid to take it.